Housekeeping pads are required in specific situations within healthcare settings, primarily to maintain hygiene and prevent the spread of infection. These situations include instances where a patient is incontinent of urine or feces, when a patient has a draining wound, when a patient is receiving enteral or parenteral nutrition, and when a patient is receiving any other treatment that necessitates the use of a pad. These pads serve to protect bedding, furniture, and the environment from bodily fluids and contaminants, thereby reducing the risk of cross-contamination and promoting a cleaner, more sanitary environment. While there isn't a specific code section mandating the use of housekeeping pads, the Centers for Medicare and Medicaid Services, often referred to as CMS, plays a crucial role in regulating healthcare facilities. CMS requires nursing homes to provide a safe and sanitary environment for their residents. This mandate encompasses providing residents with clean and dry bedding and clothing. Housekeeping pads, therefore, become a practical tool for meeting these regulatory requirements. By using these pads, healthcare facilities can more effectively maintain clean and dry conditions for patients, which contributes to overall sanitation and infection control. The absence of a dedicated code section doesn't diminish the importance of housekeeping pads. Their utilization aligns with the broader goal of providing quality patient care and adhering to established sanitation standards. The decision to implement housekeeping pads often stems from a combination of best practices, infection control protocols, and the need to comply with CMS guidelines. To elaborate further on the clinical scenarios where housekeeping pads are essential, let's consider each situation in detail. Firstly, in cases of urinary or fecal incontinence, patients may experience involuntary leakage, which can soil bedding, clothing, and furniture. Housekeeping pads act as a barrier, absorbing the leakage and preventing it from spreading. This not only maintains hygiene but also protects the patient's dignity and comfort. Secondly, draining wounds pose a significant risk of infection and contamination. Wound exudate, or drainage, can contain bacteria and other pathogens that can spread to the surrounding environment. Housekeeping pads placed beneath or around the wound site can effectively contain the drainage, minimizing the risk of infection and simplifying wound care. Thirdly, patients receiving enteral or parenteral nutrition are often vulnerable to complications such as vomiting or diarrhea. These complications can result in soiling and require prompt cleanup. Housekeeping pads can help to manage these situations by absorbing any spills or leakage, thereby maintaining a cleaner environment and preventing the spread of contaminants. Fourthly, various other treatments may necessitate the use of housekeeping pads. For example, patients undergoing certain medical procedures or experiencing excessive sweating may benefit from the protection provided by these pads. The pads can help to absorb moisture and prevent it from soaking into bedding or clothing, contributing to patient comfort and hygiene. Beyond the specific clinical scenarios, housekeeping pads also play a role in preventing the spread of infection within healthcare facilities. By containing bodily fluids and contaminants, these pads reduce the risk of cross-contamination between patients, staff, and the environment. This is particularly important in settings where patients may be immunocompromised or vulnerable to infection. Furthermore, housekeeping pads can contribute to a more efficient and cost-effective cleaning process. By preventing soiling, these pads reduce the need for frequent laundering of bedding and clothing, saving time and resources. They also simplify the process of cleaning and disinfecting surfaces, minimizing the risk of exposure to pathogens. In summary, the utilization of housekeeping pads in healthcare settings is driven by a combination of clinical need, regulatory requirements, and best practices in infection control. While there may not be a specific code section mandating their use, their value in maintaining hygiene, preventing infection, and complying with CMS guidelines is undeniable. By implementing housekeeping pads in appropriate situations, healthcare facilities can enhance patient care, promote a safer environment, and streamline cleaning processes.